Hi, my name is Kevin Pignone. I'm a summer 2020 intern at the Margolis Center, and I worked with Dr. Julian Sanders-Schmidler, and what we were working on this summer was facilitating decision modeling during the COVID-19 pandemic, along with the Society for Medical Decision Making. So before I get started, I want to explain some key terms first. So when I mention decision models, this is a quantitative model, and it's going to be used to help decision makers when they're in areas of uncertainty to kind of make key assumptions to help them eliminate uncertainty. And then when I say decision maker in this context, I'm only talking about policymakers, health system administrators, and clinicians. And you'll also hear me mention the acronym CDMI, and that's the COVID-19 Modeling Initiative. It's a grant development program that gets funding from the Moore Foundation, and it's a collaboration between Duke, Johns Hopkins, Michigan, and the Society for Medical Decision Making. You can see there's an example of a decision model on the bottom there. So the modeling initiative is focusing on solving this problem of we need to have decision makers having more informed decisions, and in order to do that, we have to connect them with research teams that have the most up-to-date and relevant information. And so this modeling initiative is trying to bridge the gap between decision makers and decision modelers. So a little bit about the project itself. Like I said, the goal is to facilitate this connection between the modelers and the decision makers. And so what I did this summer to kind of work towards that goal was populating a decision model repository. So kind of like this public commons for decision models. And as models were submitted, I would log some of the assumptions that they would make, as well as the outcomes that they were measuring. And the other activity I was working on was the questions database. So this is the same thing. It's a kind of a public commons for questions about the pandemic that could be answered through models. And I went through and analyzed the themes within these submitted questions. And I also helped create some questions through reading of my own and querying. So a little bit more about the model repository. Like I said, research teams would submit the models, and then I would abstract the data. So some of the things we were looking at was what they were trying to answer, the underlying assumptions, who they were making assumptions about, and what kind of population they were attempting to model, as well as the interventions and comparators. And I was doing this abstraction of data with the goal of building this public repository that was easily understood by decision makers and that can inform them quickly with relevant information so that they can make decisions about the pandemic. And then a little bit more about the questions repository. Like I said, organizing the questions by themes. The themes are on the right here. They're categories of questions that we put them into. And I also went out and solicited questions from a variety of decision makers. So like state health departments, hospital systems. And this was done with the intention of sampling a more diverse group of decision makers so that we could have a wider range of questions. And then I also, like I said, created some questions of my own. And here are some sample questions that we might ask for policymakers. Like I said, the categories. So, intervention strategies, testing and evaluation, health system operations, as well as like treatment and vaccination. And then finally, individual and population level well-being. So these are some kind of questions that we would get or we would develop for decision makers in this kind of public repository. Okay, so that's what I was working on this summer. If you want to learn more, you can go to the Modeling Initiative website, or you can also look at the model repository itself or the questions portal if you want to ask or submit questions. So thank you so much. I had a really good time this summer, and if you have any questions, I'd be happy to answer them.
Great, thank you. Any questions for Kevin?
It's really exciting. Thank you for sharing your work on that. I wanted to know if you could tell from the information you abstracted whether the models were better at answering some questions than others, or if there were some that were really predominant.
Well, they answered a variety of questions. One of the things that isn't in this but is on my poster presentation is we received, as of writing the poster, 74 different models. That number's increased now from over 22 countries. So there are a lot of questions being answered, but the ones that I saw, the main kind of model purpose was epidemic parameters. So kind of estimating the level, for example, like the level of infectiousness of an asymptomatic person, or the spread within a city given certain lockdown measures, so epidemic parameters in response to intervention strategies. So that was the majority of the purposes of the models I saw. There were also the other larger group of them was hospital capacity and testing capacity. And then towards the end, I also saw more, which was interesting, on university planning. So capacity, health system capacity and testing capacity in a university sense, and also attempting to predict and model the spread within a university setting. So those were became more predominant in the past couple of weeks.
Great, thank you. Yeah, and just in terms of responding for next steps, so as part of this process, we then, as Kevin mentioned at the beginning, it's part of a granting program, and I think we've, in the end, there's 9 different modeling efforts that are being funded through this, and as Kevin was saying, kind of looking at a range of different questions, and so trying to use some of the work that Kevin's been working on this summer to inform both those that were funded and then also their next steps in terms of questions they could address. Okay, any questions from folks? Otherwise, thank you, Kevin.